Bismillahirrahmanirrahim. Quote of the day: adopt the pace of nature. Her secret is patience. Assalamu alaikum. Today I will present one of communicable diseases, and that is schistosomiasis under kind supervision of Professor Dr. Saira Afzal. Learning outline of my presentation is about the introduction of disease, problem statement, mode of transmission, clinical features, prevention, treatment, recent updates, and at the end, there is an MCQ session. At the end of this presentation, participants will be able to describe about the introduction of the disease, epidemiology, clinical feature, level of prevention, along with recent advances and MCQs. Now, what is schistosomiasis? Schistosomiasis, also known as bilharzia, is a disease caused by a parasitic worms. Although the worms that cause schistosomiasis are not found in the United States, people are infected worldwide. In terms of impact, this disease is second only to malaria as the most devastating parasitic disease. Schistosomiasis is considered one of the neglected tropical diseases. The parasites that cause schistosomiasis live in certain types of fresh water, snails' water. You can become infected when your skin comes in contact with contaminated fresh water, and most humans are got infection by the three types of species: Schistosoma mansoni, Schistosoma hematobium, and Schistosoma japonicum. The disease is found in tropical countries like Africa, Caribbean, Eastern, South America, Southeast Asia, and Middle East. In 2010, approximately 238 million people were infected with schistosomiasis, 85% of whom live in Africa. An earlier estimate from 2006 had put the figure at 20 million people infected, and the latest WHO report, 23.6 million people were infected in 2022. Estimates regarding the number of deaths vary. Worldwide, the global burden of disease study issued in 1918 estimated 12,000 direct deaths, while WHO in 2022 estimated more than 2 lakh annual deaths related to schistosomiasis. The disease is most commonly found in Africa, Asia, and South America. Around 700 people million is more than 70 countries live in areas where the disease is endemic. And in tropical countries, schistosomiasis is second only to malaria among parasitic disease with the greatest economic impact. The life cycle of schistosomiasis: infected individual release schistosoma eggs into water via their fecal material or urine. After larvae hatch from these eggs, the larvae infect in a very specific type of freshwater snail. For example, S. hematobium and S. intercalatum, it is snails of the genus Bulinus, and L. Schistosoma mansoni, it is a biomafilary, and Schistosoma japonicum, it's Onca melania. The schistosoma larvae undergo the next phase of their cycle in these snails and spending their time reproducing and developing. On this step has been completed, the parasite larva leaves the snail and enters the water. The parasite can live in the water for only 48 hours without a mammalian host. Once a host has been found, the worm enters its blood vessels. For several weeks, the worms remain in the vessels, continuing its development into its adult phase. When maturity is reached, mating occurs and the eggs are produced. Eggs enter the bladder, intestine, and are excreted through urine and feces, and the process repeats. If the eggs do not get excreted, they can become invasion in the body tissue and cause a variety of problems such as immune reaction and organ damage. This is the picture of life cycle of schistosomiasis, in which you can see the eggs are released and then eggs are hatched, and it goes into the snail, and in the snail they goes into the development phases and then released in the water, and from water this stage enter into the human, and then goes into the liver during penetration, develops into schistosomia and travel into the liver to the mature form, and then pair adult form travel to the veins in the intestine or bladder, and where they lay eggs, and again the eggs are egg pass from the host into the stool and urine. So this is the life cycle of schistosomiasis. Schistosomiasis is also a concern of cattle husbandry and mice. The infectious stage starts when the free-swimming larva from the Schistosomia cerciarii penetrates the human skin using their sucker proteolytic enzyme and tail movement. The cerciarii transform into schistosomia by losing its tail and subsequently travels to the heart and lungs through venous system until it eventually reaches the liver, where it will mature into the adult form. The clinical manifestation of chronic infection is mainly caused by immune reaction to the eggs entrapment within tissue, resulting in granuloma formation and chronic inflammation. In acute infestation from schistosomia include cervical dermatitis and acute schistosomiasis 2 to 8 weeks. Cervical dermatitis, swimmer itch, is caused by a localized allergic reaction at the site of skin penetration by cerciarii, causing an inflammatory reaction that is characterized by itchy red pimples and blisters. Few weeks to month after initial infection. Acute schistosomiasis, also known as Katayama's fever. The exact pathophysiology of this disease is unknown, but it has been hypothesized to be caused by a systemic immune response due to immune complex formation type 3 hypersensitivity. With the foreign antigens on the migratory schistosomia and the eggs and the subsequent deposition of these complexes on various tissues, leading to activation of autoimmune response. Acute schistosomiasis, also known as Katayama syndrome, it is a systemic serum sickness-like illness. They develop after several weeks in some, but not most, individuals with new schistosomal infection. It may correspond to the first cycle of egg deposition, and it's associated with marked peripheral eosinophilia and circulating immune complexes. There are two forms of schistosomiasis. One is acute and other is chronic. In acute form, there is a swimmer itch, rash, fever, cough, chills, and muscle ache. And in chronic form, there is abdominal pain, ascites, enlarged liver, splenomegaly, blood in stool, diarrhea, hematuria, dysuria, varicose veins, tears, and paralysis. In acute manifestation, there are generalized lymphadenopathy, pruritic rash, mild fever, headache, hepatosplenomegaly, Katayama syndrome, diarrhea, urticaria, and cough. How we diagnose the disease? The disease is diagnosed by the identification of eggs in stool. Diagnosis of infection is confirmed by identification of egg. Microscopic identification of egg in stool or urine is the most practical method for diagnosis, and stool examination should be performed when infection with Schistosoma mansoni or japonicum is suspected, and urine examination should be performed if Schistosoma hematobium is suspected. The next diagnostic test is antibody detection. All serum specimens are tested by fast ELISA using Schistosoma mansoni adult microsomal antigen. A positive reaction greater than 9 units microliter serum indicates infection with Schistosoma species. Sensitivity for S. mansoni infection is 99%, 95%. For Schistosoma hematobium infection and less than 50% for Schistosoma japonicum infection. Specificity of this assay for detecting Schistosoma infection is 99%. PCR-based testing is accurate and rapid in a molecular diagnostic, and in laboratory testing, Schistosoma hematobium screening in the community can be done by using urine dipstick to check for hematuria, and the stool Coag test can be used to test for blood in the stool. In tissue biopsy from the rectum, bladder, and liver can be obtained to look for schistosome egg within the tissue sample, and in imaging modalities such as X-ray, ultrasound, CT, MRI can be utilized to evaluate for variety of schistosomiasis and damage of infected organs. Now comes the prevention and control. The WHO is promoting these factors. In some cases, urbanization, pollution, and consequent destruction of snail habitat have reduced exposure with a subsequent decrease in new infection. The elimination of snail population using moleculicide had been attempted to prevent schistosomiasis in the past, but it was an expensive process that often only reduced but not eliminate the snail population. The CDC advised avoiding drinking or coming into contact with contaminated water in area where schistosomiasis is common. The drug praziquantel is used for prevention in high-risk population living in areas where the disease is common. The morbidity control strategy focused on synchronous chemotherapy for human and bovine, and the new strategy developed in 2004 intervenes in the transmission pathway of schistosomiasis, mainly including replacement of bovine with machines, prohibition of grazing cattle in the grassland, improving sanitation, installation of fecal matter containers on boards, drug therapy, snail control, and health education. Two drugs, praziquantel and oxaminiquine, are available for the treatment of schistosomiasis. Because of praziquantel lower cost per treatment and oxaminiquine lack of efficacy against the urogenital form of disease caused by schistosomiasis hematobium, in journal, praziquantel is considered the first option for treatment. Praziquantel can be safely used in pregnant women and young children. Schistosomiasis is treatable by taking a single dose of drug praziquantel annually. Praziquantel only eliminates the adult schistosome, but it is not effective in killing the eggs and immature worm. Live egg can be excreted by infected individual for weeks after treatment with praziquantel. And the post-treatment monitoring. Osteopontin is a promising tool for monitoring praziquantel efficacy and post-treatment fibrosis regression, as expression is modulated by schistosoma mansoni egg antigen, and its level correlate with the severity of schistosomiasis fibrosis and portal hypertension in mice and humans. Now comes the strategic plan. The vision, a world free of schistosomiasis, and the goals to control morbidity due to schistosomiasis by 2020 and to eliminate schistosomiasis as a public health problem by 2025. To interrupt transmission of schistosomiasis in the region of America, the Eastern Mediterranean region, European region, the Southeast Asia, and the Western Pacific region, and in selected countries of the African region by 2025. What are the objectives in the strategic plan? To scale up, control, and eliminate activities in all endemic countries, to ensure an adequate supply of praziquantel and resources to meet the demand. The first goal will be achieved when the target of 100% geographical coverage, 75% national coverage, and less than 5% prevalence of heavy intensity infection are achieved in all schistosomiasis endemic countries. The second goal will be achieved when the prevalence of heavy intensity infection is less than 1% in all endemic countries. And the third goal will be achieved when the incidence of schistosomiasis is reduced to 0. Now comes the recent updates. The global epidemiological situation of schistosomiasis and new approach to control and research. It is one of the articles in which they discuss about the distribution of schistosomiasis has changed over the last 50 years, and there have been successful control programs. The number of people estimated to be infected or at risk of infection has not been reduced. Total 85% of the number of infected people are estimated to be on the Africa continent, where few control efforts are made. In terms of disease burden, there is Therefore, a growing discrepancy between sub-Saharan Africa and rest of the world. WHO has now developed a dual strategy for the control of schistosomiasis, a strategy for morbidity control adapt to the public health context in high burden areas, and a strategy to consolidate controls in area where a low endemic level has been reached and elimination may be feasible. Prevalence of human schistosomiasis in different areas of Punjab, Pakistan. This is one of the articles in which the abstract explain 2,400 fecal and 300 human blood samples collected from 4 districts of Punjab, like Lahore, Shekhapura, Gujranwala, Sialkot, were found negative for the prevalence of schistosomiasis by porological and serological diagnostic method. It is the first report showing Punjab, Pakistan, free from human schistosomiasis. Now it's time for the MCQ. There are many tropical diseases that are not important as they require for them to. These are the tip of an iceberg and generally known as neglected tropical disease. Which among the following is considered as neglected tropical disease? Amoebiasis, giardiasis, toxoplasmosis, schistosomiasis, leptospirosis.
Schistosomiasis.
Yes, schistosomiasis, D is the right answer. Mr. Ali got infected from schistosomiasis. Schistosomiasis has snail as its intermediate host where its egg reside after hatching from larva. The larva of schistosomiasis affect very specific type of snail, and that is seawater snail, freshwater snail, male snail, female snail, river water snail.
B.
Yes, B is the right answer. No, it's A, seawater snail. The larvae reproduce themselves in snails, and once the step is completed, the parasite larva leaves the snail and enters the water column. For how long time they can infect a mammalian host that are mostly human? 12 hours, 24 hours, 48 hours, 72, 92. C is the right answer, 48 hours. Acute schistosomiasis is caused in few weeks and known as Katayama fever. Also, the response to antigen is caused by systemic immune response due to immune complex formation. This came under the umbrella of following types of allergic reaction: type 1 hypersensitivity, type 2 hypersensitivity, type 3 hypersensitivity, type 4 hypersensitivity, and delay hypersensitivity reaction.
A.
No, it's C, type 3 hypersensitivity reaction. A person is having severe pain abdomen and there is some amount of blood in his urine for past 6 days. He consults his physician. He has the suspicion of schistosomiasis. In this patient, stool examination for egg was advised. Stool examination is best for which type of parasite type? Schistosomiasis manzoni, schistosomiasis hematobium, schistosomiasis plenis, oncomelania type, and schistosomiasis japonicum.
B.
A is the right answer, schistosomiasis manzoni. A person was diagnosed as schistosomiasis through ELISA and egg were seen in this stool. Schistosomiasis is treatable disease. Best treatment is given by praziquantel because of lower cost and easily available. After initial infection, what amount of drug should be given to patients to prevent from further infection? 1 dose every month, 1 dose every 3 months, 1 dose every 6 months, 1 dose every year, 1 dose every 9 months. D is the right answer, 1 dose every year. WHO has given progress report and strategic plan for the year 2012 and 2020 for the prevention and control of schistosomiasis, and the progress report show significant improvement in the disease burden and morbidity to eliminate schistosomiasis as a public health problem by 2020, in which among the following category: Vision, goal, objective, mission, plan.
D. Mission.
Its right answer is B, goal. The cerciara is the part which penetrates the human skin using their sucker. The cerciara travel in the blood from after losing their tail, and they go to all major viscera of body. However, which among the following viscera is the place where they get become mature in human? Liver, heart, bladder, brain, kidney. A, liver. One stage of schistosomiasis takes about 2 to 8 weeks to develop. The infectious stage of free-swimming larva from Schistosomiasis cerciarii. The infectious stage forms after the immediate maturation of which of the following? Myocardial stage, schistosomola, sporocyte stage, egg formation stage, larva formation stage. The right answer is C, sporocyte stage. A person having right upper quadrant pain for past few weeks along with the burning micturition presented to New Hospital OPD, where its multiple tests were advised by the physician, which include imaging technique, biopsies, blood sample. Which among the following is the most practical method for diagnosis of schistosomiasis? Blood test, urine examination, fast ELISA, ultrasound abdomen, liver function test.
B.
Yes, B is the right answer, urine examination. This is the key of MCQ. YouTube link of this presentation where all presentations uploaded, and please like and subscribe. And thank you.